Thompson Akwo, the chief editor of Health and Development magazine. And we are at the Convention Center, the city of Houston, as part of the American Association of Critical Care Nurses 2022 conference. And with me is?
Hi, I'm Vicky Good.
Nice to meet you, ma'am. I have been reliably told that you were a former president of the AACN, right?
Yes, I was a president in 2014.
So what were some of your experiences and your achievements as president?
I think, as I toured around the nation, I really found that part of the challenges with our nursing staff was the healthy work environment and the experience of burnout they were feeling. And this was even pre-pandemic. So I think now, post-pandemic, what we're really finding is that COVID-19 was an accelerant on those embers that were burning for all of our professions. So, moving forward, as our new theme was just announced, starting now, we really have to reclaim, what that looks like for our staff.
Moving forward, I suppose that as nurse leader and manager, you are not alone. You work with others in different states and hospital systems and partners around the world. So vis-a-vis your experiences, where is nursing going to now?
Well, we've got a long path forward, but I think we've got some fundamental things that can help us get there. So, number one, we've got our healthy workplace standards, and those healthy work environment standards are fundamental. And, moving forward, those have to be implemented across the United States for us to, move forward in our path. And then secondly, we have an amazing work group working on nurse staffing right now. And, this group involves multiple different organizations across the United States, including partners from Joint Commission, as well as the Centers for Medicare and Medicaid. And, really shining a light on what does the nursing staffing crisis mean for our patients, for our communities, and for our nursing profession moving forward. So that team is working right now. It's a year-long commitment as we are continuing to develop what does that path forward look like for nursing overall.
You have a new president who has been presented today to the delegates and participants. What advice, like outgoing presidents of the United States who write a short letter to the incoming president, what's the content of that, your short letter to the incoming president?
Embrace every moment and enjoy it. It's a absolutely amazing feeling to be able to gather with people across the United States and understand their needs and their wants and desires, but also just a journey with them to be able to provide them that hope and inspiration. So the first thing I tell every new incoming president is embrace every moment.
Embrace every moment. We actually have lived a very challenging and difficult moment the past 2 years, from March 2000 up to this moment with COVID.
Right.
And critical care nurses have actually put in a lot, especially in the ICU, where lots of those COVID patients were taken care of, ventilation, intubation, and things like that. So what would you say that your colleagues and you who are leaders have gathered as experience that you want to package and give to the younger ones from the COVID work?
Right. I think, this is unprecedented times for all of us. And, never in any of our careers did we think we would face such a pandemic. And, I think we all have to rely on our strength, rely on, picking up from our current president's theme of rooted in strength, pick up on that strength and realize that this is just a passing thing, and that we have to pull together and realize what brought us into nursing in the first place. And then move forward from that, grow from it, learn from it, as we continue this recovery process.
Finally, the issue of diversity and inclusion. I know that there are women here from all races,
Yes.
but the number is not the same. What are you doing to bring in more women from the minority community so that the cultural aspect of nursing, which contributes to improve outcomes, is realized?
We continually focus on that. Not only diversity in skin color, but we look at males in nursing. We look at all nationalities in nursing, and we continually are inviting them to the table. We are looking at all of our position statements, making sure that they are inclusive of all that come to our table, to make sure that we're representing everybody that we represent.
Thank you very much.